Hey guys, this is Dr. Hunt at Hunt Physical Therapy. Today we're going to talk about how to treat at home one of the most common causes of elbow pain, and that's tennis elbow. The formal name for this condition is lateral epicondylitis, but you can get this without ever having touched a tennis racket. People that have jobs where there's a lot of repetitive stress with the arms, for example, nursing or physical therapy, or people that spend a lot of time typing, we think what happens, there's a tightening phenomenon that occurs in the muscles that form the common tendon that extend the wrist. They get really tight where they insert on the side of the arm there at this little bony prominence called the lateral epicondyle. And that tightness pulls on that bone and connective tissue and causes pain. But the symptoms are pain in this area, pain in these muscles, tightness in these muscles, and a lot of times profound weakness with grip strength. I had a bad case some years ago, and I just felt like when I shook hands, I could barely, grasp somebody's hand without pain. So it can become chronic and become really frustrating to treat. But luckily, there's a lot of really effective things you can do at home. So we're going to talk about that today. So first off, what we want to do is we want to warm up because we're going to do some stretches for this. So my favorite way to warm up is just basically just flex and extend the wrist. I'll turn sideways so you can see. You can kind of do little circles like that just for a few minutes. Again, just loosen those muscles, that connective tissue up like you should do before you stretch anyway. So first stretch is just simple wrist flexion. The muscles that extend the wrist up, they're the ones that are tight. So to stretch those, we want to take the wrist into flexion. Very important, have your elbow out straight when you do this, because if you just kind of bend the wrist back like this, you're stretching a little bit, but nothing like if the elbow is fully extended like that. And it doesn't really matter where the arm is. You can kind of have it down, you can have it in front, you can even have it up over your head. As long as that elbow is locked out straight and you're flexing the wrist, you're going to stretch those tight muscles and that tendon where it inserts on the side of the arm there. And so just hold this 30 to 60 seconds. You can do this several times a day and just stretch as much as you can. I always tell my patients the stretch should be a little uncomfortable. You're not doing anything. So take it to where it's a little painful but not severe. Okay, so that stretch number 2 is called the server stretch or the waiter stretch. So simply stand like this, kind of put your arm behind your back like that, like you're accepting a tip or something like that behind your back with your arms straight, and just kind of go back as far as you can. Hold that 30 to 60 seconds. You can do that several times a day. One thing I want to bring up, they suspect another cause of pain in this region is entrapment of the radial nerve, which is an important nerve. It descends through the upper arm and it supplies a lot of muscles and sensation to the back part of the arm there. Tightness in these muscles, we think, can kind of pinch that radial nerve and cause that nerve to get really irritated and tight. So a stretch you can do for that is to stand with your arm straight out to the side and your wrist down, and we'll do a couple angles here. And then take your head and side bend away from the tight side. So going like that stretches components of that radial nerve. And again, hold that 30 to 60 seconds, do it a couple times a day. I'll turn sideways so you can see me. Here we go. So like this, and again, I'm gonna side bend away from that tight side, 30 to 60 seconds, okay? All right, so try those stretches. Now I'm gonna show you a couple things you can do with a tennis ball to loosen that muscle up, and we're gonna go over an exercise to really break at some of those adhesions and strengthen these muscles again. So here we go. Okay, another thing you can do for tennis elbow, so for this example, the pain is going to be on the left side, obviously. We talked about these bands, these long exercise bands that you can get online really cheap, I think around $20 for a pack of 4. They come in a variety of resistance, so just hook it around something. And then on the sore side, place it to where it's just underneath that elbow crease right there, okay? So it's going to be easy to find because a lot of times these muscles in here are really tender, so just put it right over that, okay? So what this does, it mobilizes that joint there, that radial ulnar joint that's gotten really tight, along with the muscles that extend the wrist. And so what you do is you just create a little tension, like bring your arm towards your body so that there's some tension in the rubber band, and then make a fist, okay? Another thing that's useful, you can see my arm, I like to kind of roll my arm in while I'm making a fist, like that. And again, make sure that you're scooting out so that there's some tension in that rubber band. And a lot of times this really helps alleviate some of that pain on the side of the elbow. So again, bring your elbow or your arm close to your body so there's some tension in the rubber band. Make a fist and then kind of rotate your arm in a few times like that. So try that, let's say 10 to 15 reps. Maybe do a couple sets each day. Okay, all right. Now we're gonna show you a way to kind of work out some of those tight muscles with a tennis ball. Okay. Okay guys, so this is a technique you can use with really any ball. I've got a tennis ball here, but any kind of ball that you can place against a door just to kind of roll up and down on those tight muscles that extend the wrist. And so I'm just placing the ball against the door and just kind of fitting in those muscles there and just pushing as hard as I can tolerate and just kind of rolling up and down, just kind of loosening up all those tight muscles in that area. Again, a little discomfort is to be expected, and that's not a bad thing. I always say if you're not causing a little bit of discomfort, you're not doing anything. So another option is just take your fingers, drop off. So the lateral epicondyle is right in there. If you drop down like a finger or two, right in that area is a lot of times where it's really supremely tender. And you can just kind of take your fingers and just go transverse. You'll feel those tight fibers. A lot of times there'll be a little twitch in there. Interestingly, the studies show one of the most common muscles involved in this condition is one called the extensor carpi radialis brevis, and it's the muscle that extends the middle finger. I'm not going to do that on camera, but sometimes it's useful to kind of do that motion, and a lot of times you can feel that trigger point, that painful knot pop up, and just kind of work in that area. I mean, mine's tight, you can kind of see a twitch in there. And again, this doesn't feel great, and I don't even have a tennis elbow right now. So just for a few minutes, just kind of work that with a tennis ball and, you know, with your fingers in there, and a lot of times that gives you a lot of relief. Okay. All right, so now finally I'm gonna show you guys an exercise you can do at home with a very light dumbbell. So here we go. Okay guys, so the final exercise is something you can do at home with a very light dumbbell. It usually doesn't take very much weight for this exercise. And this is going to focus on what we call the eccentric or lengthening component of the contraction. So to explain that quickly, eccentric is where the muscle is contracting but lengthening. Kind of like when we lower something to the ground, the muscles are contracting as they're getting longer. And so that particular type of contraction seems to be very useful for tendon injuries. So to do this, just kind of sit with your elbow propped up on the edge of a table or a counter. I like to have the edge of the table kind of hitting right there on the wrist crease. And then when I do, 15, 20 repetitions is I start with my wrist in neutral, so not cocked up, just sticking straight out. And then for about 3 to 5 seconds, just very slowly lower this dumbbell. It doesn't take a lot of resistance because most people that are experiencing this, they've got a lot of weakness in their grip anyway, so just very slowly lower the dumbbell. This is a great way to rehab this condition. You're strengthening the muscle, but I also think it's probably breaking up adhesions over there where that tendon inserts on that bone. But again, usually 15, 20 reps is plenty with this. And you could probably just do this once a day. If you can do 20 reps and it's easy, grab a heavier dumbbell. All right, guys, so that concludes today. If you like, please subscribe. Feel free to leave comments below. Again, these are some of the best ways that I have discovered over the years for people to kind of treat at home symptoms of tennis elbow. So I appreciate your time, and we'll see you soon. Thank you.